So this is what you can expect between weeks 9 and 12 post-surgery. So by week 12, you should feel more confident with everyday activities, and you can talk to your physio about how to progress exercises to continue strengthening. In terms of some of the goals that you can or benchmarks that you can rely on, you should be able to walk without a limp, and you can discuss with your physio how long you should be able to walk for. At 12 weeks, you should also start to be able to sit to stand from a regular height chair or toilet without using your arms for assistance. You should also be able to climb up and down stairs with an alternating pattern, and hopefully not using any railing support either, so maintaining balance as you're walking up and down stairs as well. And you may also be able to return to driving with the surgeon's approval. So that's something that is a little bit more specific on a case-by-case basis, so make sure you have their approval first, but this is the timeline that would be realistic for that. Okay, so for the first exercise, we're going to be lying on our stomach like this. You can put a pillow just underneath your hips, and you're going to keep your upper body nice and relaxed. Now there's 3 progressions to this one. So the first one is going to be keeping your leg nice and straight. So while you're down here, you're just going to be trying to lift your straight leg off the ground and back down. Now make sure with this exercise we're not compensating by using the lower back and doing this. Okay, all the movement should be coming from the hip. Once that starts to feel easy, the 2 ways we can progress it. The first one is going to be just bending the leg and then coming straight up and down. And the second way to progress this exercise is going to be keeping it straight, but you're going to come up and then out and back and down. So you're going to do that lift, and then you're going to go out and back and down. With these exercises, you should repeat them 8 to 15 times and try and do that 3 days per week. The next exercise is the side lying leg lift. So for this one, we're going to be lying down on our sides like this, making sure our hips are rolled forward so they're perpendicular with the bed. And the 2 different ways to do this are one with a bent leg, and all we're going to do is lift it straight up to the side, hold it for 6 seconds. So 1, 2, 3, 4, 5, 6, and come back down. The harder way is going to be with the straight leg. So holding up, 2, 3, 4, 5, 6, and coming back down. For both of these, try and repeat it between 8 and 15 times, and doing that 3 days per week. So the next exercise is a more advanced version of the bridge that we did earlier. So for this exercise, you're going to be lying on your back. The leg that's going to be doing all the work is going to stay flat on the bed here, and the other one you can lift up to about 90 degrees. And all you're going to do is push with the hip that's on the ground, so in my case, the right hip, and you're going to try and lift it off the ground and come back down. With this exercise, you want to really make sure that you engage your core muscles first, as we talked about earlier, and maintain that engagement throughout the exercise. So lifting up and down, up and down. To make this exercise harder, all we're going to do is straighten out this other leg, and lifting up and down, up and down. So repeat this exercise between 8 to 15 times and do this 3 days per week. Okay, so this next exercise is going to be a split squat or a lunge. So make sure that you're beside something you can hold on to, whether that's a wall or a counter, whatever's best. And you're going to raise one leg in front of you and one behind you. You're going to focus on trying to keep your body nice and level and upright as you just think about going down and up. So it should look something like this. And you can repeat that on both sides. Try and do it 8 to 15 times, and make sure you do it 3 times per week. The next exercise is going to be a step up. So for this one, you're just going to step up with one leg. You're going to straighten up and try and focus on not using any momentum and just using the strength in your muscles, and you're going to come down. Okay, with this exercise, your leg should be the first one up and the last one down. So first one up and last one down, and then you'll alternate and make sure that we're working on both sides. Always have a railing beside you or something to hold on to, especially as you're starting with this exercise. The next progression for this one will be a side step up. So you can do it like this, where you're doing the same exercise, but we're just going sideways and stepping up and stepping down. Repeat this exercise 8 to 15 repetitions and 3 days per week. So this next exercise is going to be a balance exercise, and it's going to use a balance board like this, or at home if you don't have one, you can always use a pillow, and that'll work well too. So the first exercise is just going to be standing on the board or pillow like this, holding onto something, making sure that you have something to be safe. And you're just going to practice putting weight through the board and kind of maintaining stability. Once that starts to feel pretty easy, then we can try bending one leg at a time and shifting our weight back and forth. And if that feels okay, then we can also try shifting forward and back, all while maintaining balance. And the way to progress this, if it starts to feel easy, is you can basically rely on whatever you're holding on to less and less, and try and balance without holding on to anything and doing those same shifting motions. Okay, so once we get to the 3-month period, then one of the most important things is just staying aerobically active and doing lots of exercises going forward. So regular physical activity will help increase the life of your joint replacement and help it last for longer. And regular exercise will also help you to increase your fitness and endurance, reduce your risk of falling, increase muscle strength, improve bone quality and strength, maintain a healthy weight, and reduce risk of other health conditions like diabetes, heart disease, and stroke. So one of the things that we can look at for this is even just the Canadian Physical Activity Guidelines. So for adults, basically all adults can benefit from 30 minutes of aerobic activity 5 days per week. And you can do 10 minutes 3 times in the day to total 30 minutes if that's easier, or 30 minutes all at once. But basically getting that 30 minutes 5 days a week is going to really help with your health as well as the health of the hip replacement after surgery. So now we're going to go through a few different types of exercises that are going to be important afterwards and kind of continuing on. So it takes up to a year before everything kind of in your legs gets back to normal essentially. So one of the areas that we want to talk about is going to be strength training. So going forward, long-term exercise to strengthen will really help with those day-to-day activities such as climbing stairs and balance, and it can really help protect your replaced joint as well. So in terms of some of the guidelines, is we want you to do exercises where you're doing between 8 and 15 reps of each of the exercises. And in terms of the specific exercises, you can also talk to your physiotherapist about this, and they can give you some kind of more specific recommendations. But generally, you want to do these exercises until you feel some muscle fatigue, that maybe you're having a harder time kind of moving through the full range of motion at the end, or your muscle begins to shake. Those are all really good signs that we've done these exercises until the point of fatigue and we've been challenged enough. So we want to make sure when we're doing these exercises that we are kind of getting to that point. So like I said, 8 to 15 repetitions, and try and exercise about 3 times per week if you can, to really kind of continue seeing progress. So after the 3-month period, we want to make sure that we're staying active and exercising in each of kind of those 4 realms. So the 4 realms are aerobic activity, strength training, neuromuscular and balance training, and flexibility. So we've already touched on exercises for each of these, but first for aerobic, you want to try and get at least 30 minutes of aerobic activity 5 days per week. In terms of strength training and flexibility and neuromuscular and balance training, you can refer back to all those exercises that we've covered. Once they start to feel easy, you can consult with your physiotherapist on how to progress them to make sure that you're continuing to challenge yourself and getting back to where you want to be. So in terms of leisure and sport after your hip replacement, there are some sports that you're allowed to do and some that you're not allowed to do. Always listen to your surgeon, physiotherapist, or other healthcare professional in regards to your case specifically, but in general, this is kind of what you can expect. So these are some examples of different activities and sports that you can and can't do.